Years. My name is Erica Calderón. I work for the Inter-American Institute for Cooperation on Agriculture, IICA, and we are coordinating with the interagency group. We are working under the framework of GSTAT to share with you all these webinars we have been holding regarding preparedness, prevention, and response to African swine fever and other cross-boundary diseases. So welcome. Today, we have a very interesting webinar on epidemiological surveillance overall regarding prevention and response. We have excellent panelists, but before we start, though, with some of the details of today's webinar, I would like to offer the floor for opening remarks to the Director of Agricultural Health and Food Safety Division at IICA, Jose Urdas. Dr. Urdas will share a few words. So, Dr. Urdas, the floor is yours. Thank you very much, Erica. Good morning, everyone. I would like to warmly welcome you once again to this series of webinars in preparing for prevention and response to African swine fever and other cross-boundary diseases. As we know, fighting against cross-boundary diseases, as is African swine fever, is continuous. Even though countries have different levels of preparedness, this should be a continuous effort. We are never prepared well enough to face the agricultural challenges that appear. Diseases, as we know, change. They evolve. And we should also evolve with them. So it is necessary always to highlight the unprecedented work that this interagency group under the umbrella of GSTAT carries out month by month, holding these webinars in order to prepare the countries to prevent and respond to African swine fever and other cross-boundary diseases. Once again, the commitment is not only for the Technical Cooperation Agency, but for all institutions, both official as well as private, throughout the hemisphere that have been participating and that we really hope that these webinars have marked a before and an after in all this preparedness. Based on all the training we have taken into our activities, we hope this is of great benefit for the national and regional level. We are entering a new phase. We are beginning with the areas of surveillance, both for the prevention as well as prevention in the event of an emergency. This is effective for effective prevention, control, and eradication of any cross-boundary disease. And for this, we have excellent speakers today that will share their experiences. So once again, I wish you great success in this event today, and I hope you can continue with the models and recommendations we want to share with all of you. Thank you, and have a very good webinar. Thank you, Erica. Thank you, Dr. Urdas. Now I will offer the floor to Dr. Sharon Veda, Vice President of CARIVET. Go ahead, Dr. Sharon.
Good morning, good afternoon, good evening. I'm not sure in which area you are. Thanks for joining us today at the webinar on African swine fever, epidemiological surveillance of transboundary diseases. For those who do not know me, I'm Sharon Veda, Vice President of CARIVET. So, dear colleagues, it is an honor for me on behalf of the presidency of CARIVET and the steering committee to welcome you to this important webinar, where we have as purpose to explain the fundamental aspects of transboundary disease, surveillance, prevention, and response with countries of the Americas and the Caribbean sharing the successful experiences of the other countries in those areas. There are a series of webinars preparing us for African swine fever. Today, we will focus on the epidemiological surveillance of African swine fever. where we will look at the aspects of surveillance, but same time get the shared experience of our colleagues in the other countries, Nicaragua and Mexico. So this webinar is organized by an interagency initiative. Several institutions who contribute to prepare the countries in the region for different transboundary diseases, and where our institute, AICA, has the lead in the organization. So we want to thank them for that. During the development of the webinar, there are several topics of interest that were shared and were already shared in other webinars. So we had several webinars that passed already and were discussed, for example, the impact and importance of this disease, diagnosis, epidemiological investigation of outbreaks, control, biosecurity. But today, we will focus on the surveillance and then get more information from the experts. So we are sure that the dialogue and professional exchange will enrich the plant activities and the knowledge of all in the prevention and control of the disease currently present in our region. And that according to the report on the current situation of animal health in the world, it continues to be, together with highly pathogenic avian influenza, the two diseases and infections of greatest interest worldwide at the moment. Even though we have different levels of preparedness or development in the region, we can still share information, collaborate, and coordinate among each other so we can have a good response in case of any emergency in our countries in the region. With that said, I want to invite you all to have an active participation in this webinar and to share your best experiences and knowledge in this important training. And I would say on behalf of the presidency of CARIFET, I wish all of us participants a productive and informative webinar. Thank you for joining.
Muchísimas gracias, doctora Sharon.
Thank you very much, Dr. Sharon, for your kind words. Well, with this, we have officially opened our webinar for today in epidemiological surveillance. As I said before, we have excellent presentations today. There will be a presentation on the basics of surveillance by Dr. Marie-Jean Guénin, who is part of CIRAD. We will also have the experience of Nicaragua through Dr. Wilmer Juarez, Director of the Veterinary Services in Nicaragua. And we will also hear the experience of Mexico, shared by Dr. Roberto Navarro from the Mexican Veterinary Services. So, there are excellent experiences we will be hearing about today. And as I repeat, all this effort, all these webinars that we share with you every month is basically an interagency, a joint effort, both of agencies, well, through the coordination of ICA, OIDS, WOA, FAO, CARIVET, CAFSA, USDA, LACAN, CBP. So as you can see, there are several agencies that we meet every week, basically, to schedule these activities, to offer you the best training and regarding preparedness and prevention of African swine fever and other cross-boundary diseases. Without further ado, I would like to introduce Marie-Jean. But before I offer her the opportunity to share her presentation, a bit of information about Dr. Marie-Jean. She's a veterinary, graduated in 2019 at the National Vet Agro of Lion School. In 2018 and 2019, she participated in international master at the University of Kasserstad in Bangkok in coordination with Surat and the Veterinary School of Toulouse in France to become specialized in prevention and control of diseases under the prism of the One Health approach. In this context, she did her master's practice at CIRAD, UMR Astre, in the framework of the European project called EBOSURI. The objective was to establish a community surveillance system for viral hemorrhagic diseases in Guinea, adopting the One Health approach. She will now, well, after that, she defended her PhD thesis within the unit of Astra CIRAD and in the Roadmap European project on strategic planning for better use of antimicrobials in livestock. During these practices and her master's, she became specialized in the use of participatory approaches to overcome public health problems. And since September 2023, she returned to UMR Astre, but this time now based in Guadeloupe, as part of the Interreg Oscar project, which basically is the One Health approach in the Caribbean, to establish a regional community of practice in One Health. So with this experience, I leave you now with Dr. Mary Jane. The microphone is yours so that you can share your presentation and your screen. Thank you.
Doctora, no la escucho.
We do not hear you. I believe your microphone is turned off.
Tiene el micrófono apagado.
Okay, sorry, can you hear me?
Ahora sí.
Yes, thank you for introducing my presentation, and thank you for giving me the opportunity to do it. So do you have the full screen version of my presentation? Yes?
Sí la vemos.
Okay.
Yes, we do. Thank you.
So during the next 30 minutes, I am going to present you and to introduce you the fundamental aspects of surveillance. So the basis to design a surveillance system. So let's see. Oh, I can switch the slides. Oh, okay, it works. So my background in surveillance is quite short, actually. It is related to my master internship. The aim of this internship was to build a preliminary study for implementation of a community-based surveillance system for emerging zoonoses, and particularly viral hemorrhagic fevers in Guinea. So I collected information to adapt case definitions for each category of health actors, from human, animals, and wildlife health, and also information to propose and validate an information chain, including all health actors from local to central level. So what is epidemiologic surveillance? This is the ongoing systematic collection, compilation, analysis, and interpretation of health data. It allows epidemiologists to follow in time and space the health status and some risk factors associated with diseases for a given population. It allows also the dissemination of information within a time frame and feedback of the results to those who need to know. It means actors of a network, vets, farmers, but also policymakers, so that they can plan, implement, and evaluate disease control measures. So nowadays, we know that globalization and human activities such as population movements, lifestyles, industrial farming, etc., caused damages on ecosystems, but also global warming and other environmental changes. And this contributes to the spread of viruses worldwide, the ecological adaptation of vectors, the pathogen resistance, and also impact the ecology of diseases. Many studies show that all these factors are linked to the increasing epidemics in the recent past decades. And 75% of these epidemics are zoonotic and come from animal populations. We know also that they impact mostly the medium and low income countries as they have lower health infrastructures. So this is why we need health surveillance, risk assessment, preparedness, and also response capabilities. The Quadripartite Alliance promotes international cooperation as the disease could spread to a country to another, from a country to another one. They also promote intersectoral cooperation through the One Health approach. And many studies showed that it is better to avoid diseases through surveillance system to have a lower economic losses, while at the same time bringing benefits to society in terms of health and economics. So here a short definition of surveillance and survey to make the difference. So survey is an investigation in which defined information is collected during a restricted time. It might be used to test hypotheses, whereas surveillance is usually based on information collected as part of a routine health system, and it may sometimes be based on repeated structured surveys. Also, a difference between monitoring and surveillance. Monitoring is a continuous collection of data in a given population to assess its health and disease status and measure the effect of control programs. Surveillance is a specific case of monitoring in which control or eradication measures are implemented whenever certain threshold levels related to the infection of disease status have been exceeded. So surveillance is based on 3 components: a defined disease monitoring, a defined threshold for disease level at which action will be taken, and finally, a predefined directed actions. So what is a threshold in surveillance? This is a marker that alerts public or veterinary health officials to take action. It is defined using historical data, for example, the mean number of cases for a past period, to decide if a current event is abnormal or not. It could be based also using the expected number of cases as a baseline to identify possible outbreaks with surveillance data. So now I will develop the different steps to design a surveillance system. So the first step is to define the objective of your surveillance system. So as I previously said, the main objective is to know the situation in order to take actions. So surveillance system is a tool for decision makers in the control of animal diseases. But it is also necessary to describe in details, and before surveillance comes into operation, what specific objectives the surveillance system needs to achieve in order to choose the best type of surveillance strategies and activities to adopt. So for example, it could be early detection of the emergence of a disease or infection, early detection of the emergence of an exotic disease or infection, but it could be also for the evaluation of the health status of a population, such as follow-up of disease pattern. And it could be also for the confirmation of the absence of a specific disease for freedom declaration. So the final objective of the surveillance system is to enable prompt response to diseases outbreaks. It helps also to define priorities for disease control and preventions, to have an efficient allocation of resources. It helps also to support the planning, development, and implementation of policies for the animal and public health, to evaluate the disease control program's effectiveness, but it also provides information to plan and conduct research. So the second step is to select the hazard we would like to cover through the surveillance system. So this is the disease or the pathogen that we would like to cover by the surveillance. So the selected diseases has to be of interest, which match with the interest of population and local authorities, to easily integrate the surveillance system, to increase involvement of actors in case detection, and also to avoid to overload the surveillance system with diseases out of interest. So here it is important to investigate previously the local knowledge on the disease and the surveillance means to better adapt the type of surveillance to the hazard. So the next step is about the targeted population. So the populations targeted by the surveillance system and in which we want to detect the onset of the hazard could be of different category. So we can search the hazard in the human population, for example, but also in domestic animals or in wild animals. But here, wildlife surveillance requires specific means that you need to investigate before to be sure that you are able to conduct wildlife surveillance. And in a One Health approach, it is optimized to search the hazard on the three categories of populations. So the next step is about case definition. So this is a set of uniform criteria used to define the disease for health surveillance and in making a decision as to whether an individual from the targeted population has a disease or not. The use of an harmonized case definitions allows for standardization of the cases of interest, both within an ongoing outbreak investigation and possibly between outbreak investigations that differ over time or geographic location. So it's for comparison. It enables public health officials to classify and count cases consistently across reporting jurisdictions. So case definition includes criteria for individual. So they are the key characteristics the individuals share in common, for example, age, sex, species, race, occupation, or other exclusion criteria. Place, which is a specific geographic location, for example, the state, the county, or facility associated with the outbreak. So, for example, nursing home, organic farms, slaughterhouse, etc. Another criteria is time, to delineate a period of time associated with illness onset for the cases under investigation. And finally, you have to include clinical features, which should be simple and objective, such as sudden onset of fever and cough, and may later be characterized by the presence of specific laboratory findings. So there are different levels of certainty according case definitions. So there is the suspect case definition, which includes possible case, which is usually a case with the clinical criteria as described in the case definition, without epidemiological or laboratory evidence of the disease in question. It includes also probable case, which is more certain, which is usually a case with clinical criteria and an epidemiological link as described in the case definition. And finally, the confirmed case is when the causative agent has been found through lab results, for example, and can be linked with the observed signs. So the development of a clear and useful case definition is very critical to effective investigation of an outbreak. The case definition and its sensitivity and specificity depends on the objectives of the surveillance. So to explain a little bit more what is sensitivity and specificity of a case definition, here you have a table. So true positive are animals with disease and with a positive test. False negative are animals with disease but negative test. False positive are animals without disease but with positive test. And true negative are animals without disease but with negative test. So the sensitivity is the number of true positive, so animals with disease and positive test, over the number of animals with disease, so the true positive and the false negative. Specificity is the number of true negative, so animals without disease and with negative test, over animals without disease, so the true negative and the false positive. So the sensitivity is a probability of a positive test knowing that the animal has the disease, whereas the specificity is a probability of a negative test knowing that the animal does not have a disease. The sensitivity measures the capacity of a case definition to detect animals with the disease, whereas the specificity measures the capacity of a case definition to detect animals without the disease. So the low sensitivity, in case of low sensitivity, some of those who have the disease will not be included as cases. And in case of low specificity, some of those that are tested as positive will not have the disease. Therefore, in an ideal surveillance system, case definition will be sensitive enough not to omit real positive cases. So it means that all cases in the population will be detected. And case definition are specific enough not to overload the surveillance system with false positive cases. It means that all those that the surveillance system identify as having the disease will indeed have the disease. But in real life, using a broad case definition to improve sensitivity will increase the rate of false positives and decrease specificity. Similarly, using a narrow case definition to improve specificity will increase the rate of false negative and decrease sensitivity. So sensitivity and specificity depends on the objectives and have to be adapted to the selected hazard. So if the objective of a surveillance system is to exclude the disease, or if a false positive result has no serious consequences, or if the disease is rare and the objective is the early detection, so we aim to have a high sensitivity. On the other hand, if the objective is to affirm or confirm the diagnosis, or if the risk of a false positive result is serious and unacceptable, so we will aim to have a high specificity. So in practice, case definitions need to be adapted, practical, and applicable by communities. And you can evaluate the sensitivity through an external evaluation through a mechanism such as a survey. There is another important value, which is a positive predictive value for case definition, which is a number of true positive over the number of animals with positive tests, so the true positive and the false positive. So this is a probability that the animal actually has the disease knowing the test is positive. It measures the capacity of the test to confirm, when positive, the presence of the disease. In case of low positive predictive value, not all of those who meet the case definition will actually have the disease. So positive predictive value is important if the surveillance system may trigger further investigation of individual cases of outbreaks. And if the positive predictive value is low, resources will be wasted searching cases that do not exist. So the next step is about the selection of surveillance strategy you want to implement in your surveillance system. So there are two main modalities of surveillance, the passive and the active ones. So the passive surveillance is the scan or event-based surveillance based on monitoring. So it allows to monitor the health disease status, and it is basically relying on farmers' communication and visual observation. This is a routine ongoing collection of information on health events, and the information may be collected and reported on a voluntary or mandatory basis through passive collection through reporting, for example, or through active collection through visits. Data may come from a variety of sources and field actors, such as breeders, veterinarians, drug sellers, laboratories, slaughterhouses, etc. Active surveillance is defined as a targeted surveillance. It is the frequent and regular effort to determine the animal health status in a given subpopulation. It is based on the collection of data through pre-planned action. So it means it is possible to anticipate and know the quantity and type of data, as well as where it will be collected. Any surveillance method based on a search for data through action scheduled in advance is active surveillance. So it could be, for example, sentinel surveillance, risk-based surveillance, but I will come on it later. So passive surveillance is useful for global surveillance, for identification of general health trends, for collection of historical data on the health status of the country, for early detection system, and for detection of unsuspected events, diseases. Active surveillance is useful for estimation of prevalence of outcomes like clinical diseases, seropositive animals, for assessment of disease presence or absence, for the estimation of disease incidence, and to have an idea of the frequency of risk factors and its potential association with outcomes. So there are several advantages, pros and cons to passive and active surveillance. So passive surveillance is less expensive than active surveillance. It allows to cover a large population or a vast region, and it is easier to implement, whereas active surveillance is time-consuming and requires a rigorous method. But passive surveillance has a low sensitivity and specificity, whereas active surveillance allows to be more accurate and complete. So in real, both of these modalities are often used in a complementary way and are necessary components of national surveillance systems. Indeed, surveillance systems are composed of several surveillance strategies, and the strategy to be adopted will depend on the disease that we want to monitor. So here are some examples of surveillance strategies. So the risk-based surveillance, which is based on the search for cases in a population at risk. It implies a clear identification of risk factors and a precise risk analysis beforehand in order to target the population most at risk of being affected by a disease. It is deliberately non-representative, and it increases the sensitivity of the system by increasing the probability of detecting a case in our sample of individuals. So this type of surveillance is highly effective in detecting the presence of a disease or in demonstrating the absence of a disease. Then we have a sentinel surveillance, which is a special case of risk-based surveillance. So the sentinel population is a relatively small sample, not representative of the overall population, which will be regularly examined and tested for the disease of interest. So in animal health, sentinel surveillance generally involves a limited number of farms in a region considered at risk for the selected hazard. The syndromic surveillance, which is an approach in which health service personnel, assisted by automatic data acquisition and statistical alert generation, monitor disease indicators in real or near real time to detect disease outbreaks earlier than traditional public health methods. It is based on the routine collection and analysis of health-related data. So it is based also on the monitoring of health indicators that mark the early stage of health events. It aims to early detect the emergence of a health phenomenon, new diseases, or epidemics. It is non-specific, as it doesn't concern a specific disease, but rather it is based on detection of syndromes, including non-specific symptoms, signs, or types of disease. It provides decision makers with continuous information and enables them to implement an appropriate control response. Then we have also the participatory or community-based surveillance. So this is the systematic detection and reporting of events of public health importance within a community and by the members of the community. So it involves interactive participation in data collection, in analysis, and in action planning. It explores the social context in which a disease occurs, the host-agent environment interaction, and local knowledge. It takes into account the needs of local population as well as the perspectives of government and private sector. It promotes collective local initiatives, helps people to communicate, act, and decide together, and strengthen the links between population and local elected representatives. So it will increase the chances of sustainability of the surveillance system. It is complementary to the traditional system currently established by the central services by reducing the burden on health infrastructures and by supporting data collection. So it is increasingly used for active surveillance of endemic, epidemic, and emerging diseases in developing countries as it is less expensive. After, you have to define the surveillance network of your surveillance system. So what is a surveillance network? It's a group of people or organisms which is structured to implement surveillance of one or several pathological entities in a given area. So you have to wonder who is collecting the data, who contributes in transmission and management of health data. So it could be different actors, the field actors, farmers, community agents, etc. Private sectors, including slaughterhouse, meat industry, provincial, district, and veterinary staff, laboratories at different levels, national veterinary authorities, And finally, international organisms for sanitary legislation and policies or trade exigencies. So here it's important to mention that the science of epidemiology provides the foundation for surveillance and monitoring, and a national epidemiological system should incorporate surveillance and or monitoring actors, description of host population characteristics, and environmental assessment. Therefore, an effective veterinary network such as the Carib Vet Network is necessary to support epidemiological system. Taking into account the strengths and weaknesses of the stakeholders in the surveillance network can lead to an effective and powerful health program. It is also required to have an important coordination between all actors and at different levels, and to develop tools to support this network, such as meetings, workshops, trainings, platforms, etc. There is also a need to sensitize and train actors about the diseases under surveillance, about epidemiologic surveillance, and also about the functioning of network to obtain their active involvement and get the system functioning. So here, pictures of what could be a surveillance network. So it is important to involve actors in data collection, but also to think about the feedback of information at different levels. So here you have to think about the data collection process. So there is a need of an accurate and standardized protocol. So accuracy is the ability to describe correctly the field situation, and it is based on precision and relevance of the surveillance protocol and depends on field staff respect of the surveillance protocol. Standardization is used to make comparable different data sets related to animals which differ from each other for one or more parameters. In epidemiology, standardization concerns the tools and the surveillance methods in order to limit bias related to the data section or collection. So why is standardization necessary in epidemiosurveillance? Because many actors are involved in the data collection and the data collected must be similar. It is also because the data collection is spread out over a long period, so there is a risk of modification in the way the data are collected, analyzed, or interpreted if no clear procedures are available. So standardization is related to case definition, samples, information collected, but also data collection and analysis method, centralization of data. So you have to think about the way of collecting data. So the sampling method, the sampling size, the criteria of your sample. So for example, species, age, but also the geographical location. And the surveillance can be applied to the whole population to notify of disease or to a sample of the population. And here you have to think about if you are representative or not. So for the samples, they have to be feasible by the network participants. You need to have the available equipment for diagnostic tools and also to train people to sample. You could use also questionnaire. They have to be easy to understand, traceable, relevant, and should be tested on the field. And you need also to train people who are going to collect the information. You have also to think about the frequency of the collection of the data and also about who is going to provide the data. So the sources of data and the actors of the network who will be involved in the collection. So then you have to analyze your data. So you have to beforehand to define the expected results from analysis. You have to control the relevance of number and quality, validate the data collection. So it means you have to identify if there are data which are not useful or if there are missing data, illogic data, falsified data before to start your analysis. So you have to design the database before the start of the analysis. to plan the frequency of recording, and to plan the method of data management and analysis. So for example, if you need specific softwares or to develop or use specific analysis method, you have to be trained on this method. So then when you do your analysis, you have to produce a general representation of data, to compare the indicators, and to collectively integrate this descriptive data with several experts, and finally to present the result to the decision makers. And the results, the synthesis of results, has to be clear, precise, and concise. So finally, the last step is about data communication. So you have to design the contents of the feedback of your health information and results of analysis. So you have to wonder which data or information will be communicated, what form of communication you will use, the frequency of feedback, and for whom and by whom. So you have to develop an internal communication included, so for actors of the surveillance network. So it is useful to show that field agents' work is useful and that the network is useful. So it keeps the dynamic among actors active. It allows maybe also to have actors less reluctant to give information if they see that it is useful to give them. So it could be done, provide to the farmers through different actors, official services, private vets, etc. And you have also to develop external communication for partners, for example, at the national, regional, and international levels, to provide information for the policymakers to take action. And it allows to show to the regional and international partners that the dynamics of the networks produce results and is efficient. It is also useful for certification for free zones and for trade. So you have different forms of communication, for example, feedback of lab results, epidemiological bulletin, which include results of survey, technical data, reports on activity of the network members, or different announcements. It has to be short, concise, visual, regular, and it could be produced by an epidemiologic unit team. You could use technical and scientific reports, but also website or communication to the farmers through meetings, through other actors such as the vet, and also through participatory epidemiology. So you have to choose the right form, which is adapted to the public you aim to reach. So maybe I finished a little bit late, I am sorry, but thank you for your attention.
Muchísimas gracias, doctora Mary Jane. Muy interesante todo el recorrido.
Well,
de
thank you
los-
very much, Dr. Mary Jane. Thank you very much for telling us about all the different steps in surveillance. And this clarifies many of the concepts regarding these foundations. And this also opens the door for the next presentations, which would be mentioning the experiences in country regarding this topic. So we're going to leave the questions for the end. I'm going to remind you that these webinars are being broadcasted via social media and that they are also interpreted into Spanish, English, French, and Portuguese. You can also ask your questions using the chat box or the Q&A box. So there are a number of questions, and you can ask questions for Dr. Mary Jane. And now we will be listening to Dr. Wilmer Juarez, and you can ask your questions for him or ask your questions for him in the chat box too. So now we're going to continue with Dr. Wilmer. As I mentioned before, Dr. Wilmer is the chief or the director of the animal health of the Institute of Agricultural Protection and Health of IPSA of Nicaragua. He is a veterinarian, and he will be talking to us about Nicaragua's experience on surveillance systems. Doctor, the floor is yours. You just need to change your presentation or switch your presentation to presentation mode. In the meantime, you can write in the chat box where you're joining us from. We have people from the University of Matanzas, Cuba, the Agency for Fetal and Sanitary System of Ecuador, Panama, Venezuela, SINASICA, Mexico, Mara, Guatemala, ICA, Colombia, the Division of Production and Animal Health in San Vicente and St. Vincent and Grenadines, the from Belize as well, and Dominica. So without further ado, sir, the floor is yours. So hello, good morning. Can you see my presentation in presentation mode now? Yes, we can. Okay, great. Thank you. Good morning. Thank you very much for inviting me to be here. And greetings to all my colleagues in the region. As Erika was saying, I am the Director of Animal Health of the IPSA in Nicaragua. Just to mention briefly what IPSA is, it's the health authority, regulating authority that regulates veterinary services, the agricultural quarantines, the agri-food systems, diagnosis, everything that has to do with veterinary diagnosis as well, and vegetables health. This is relatively new. It was founded on May 13th, 2014, under the Act 862, which is the act that founded us as an institution in charge of doing everything that has to do with primary production and also processing facilities. This is the flow chart. I'm not going to go into it in detail, but I just wanted to show you what our institution looks like. The executive director is the top authority at IPSA. He is a minister, and we depend directly from the president of the republic. So we have four departments, sorry. The Department for Surveillance, Epidemiology, and Campaigns. That is a core section for animal health, where we have all the different sections by species. And from here, we execute all the different health programs aimed at controlling and eradicating and preventing all the different diseases in each of the sections. They all have their own personnel or their staff, and we have these people located in 17 places at the national level, and we coordinate all the different health-related actions within each program. Then we have the Department for Livestock and Agricultural Input and Regulation, and everything that has to do with veterinary input for the different animal species that we have in the country. Then we have a genetic department as well. What we do here is carry out the genealogical registration for bovine and porcine, and also a department for animal well-being. Now, epidemiological surveillance. In each of our sections, we have a program for active surveillance for different species and diseases that I'm going to be mentioning throughout my presentation. But for us, it is also very important to have a passive surveillance, or paying attention to all the different suspicion that may be of different diseases that we may catch using our sensors in field or during field visits. Something important for IPSA and for a directorate is being able to make to systematize all of our information. So it's provided in real time. whether it's passive or active surveillance, we have the capacity to monitor and follow up things from the very moment the information is being compiled. The moment we're taking the sample at the field, our system at the central level and laboratory and in veterinary diagnosis, we have the capacity to see what type of samples and for what species and for what diseases the information is being sent to the field. So all the information functions in mobile applications where our personnel can include the necessary information, the necessary epidemiological information from an app that we have developed and use it in our mobile devices or phones. We also have this web-based application, but for now, we are using the mobile app more than the web one, and this allows us to have information in real time. The module or the system is quite dynamic. It has different catalogs. For us, it is very important to obtain the general information of where something is being collected or attended. We have the information of susceptible animals, the diagnosis. We also look at the infrastructure. We look at the different elements or variables that may be a determining factor when having an outbreak, like mobilization, and also the number of samples or individuals that are being tested when checking a claim or we're doing a sampling of the active surveillance programs we have. So for all of this, there's a direct link with our laboratory for veterinary diagnosis, and this is managed directly from the system. When the sample or the samples go into the lab, they have an ID, and all the information that is gathered in the field is located there, and the lab confirms that the information of the ID matches with what is physically arriving. I'm talking about the samples. And after the analysis, the lab will then provide us with the final outcome or result. This is a screenshot on how we implement surveillance in the different production areas at the national level. This information is in real time, as I said before. Each of the visits that our staff members or veterinarians do to the different production units, we have the capacity to monitor and give follow-up and document what they are doing in the field. And through this application.
To mention this in greater detail now, we can see the different programs regarding cross-boundary diseases. Allow me to focus the different species we work on. Particularly with poultry, we have a national program for avian disease surveillance, the avian influenza. And different similar diseases are very important for us because we are part of the wild waterfowl that is transiting through the area. You can see the routes, the trajectories these birds fly, particularly now in October, November, and early in the next year, January and February. These are critical for our region because precisely due to the bird migration routes. This has allowed us to develop surveillance throughout all the risk areas. We have been able to determine 384 hazard points, and by this I mean wetlands, lakes, lagoons, coastal areas, and all those places where birds could rest. And this is a big risk for the different backyard poultry and for big facilities. Ever since 2022, when there was an increase in cases in the region, we strengthened all surveillance activities in these areas of risk. And this is part of the monitoring cycle that are basically we are involved in, both in all the different areas, both in the production plants and farms, or in these crossing areas, the flyover areas. So we continuously monitor these areas, as I said, because there's a considerable production of backyard poultry. So on the left of your screen, no, excuse me, on the right of your screen, you can see the points, the monitoring points that our veterinary doctors visit every day, searching for animals with the respiratory diseases, particularly poultry. And well, we have some diseases, bee diseases, which, well, we have historically been free of this, the European or American loci, and we have the characterization and all the information. And as I mentioned earlier in my presentation, we have all the surveillance in species. This is all systematized. With shrimp, the same situation. Perhaps here it is a bit easier to manage information and surveillance because aquaculture production is in the northwest corner of the country. We share in the Gulf. We share the Gulf of Fonseca with Honduras and El Salvador, and that is where shrimp farming mostly occurs. So it makes it easier to monitor. For bovines, this is one of the lines of greatest importance for us here in Nicaragua. Livestock is the area that is growing the most. We have programs defined for bovine tuberculosis, a program for rabies, the national program for the prevention of bovine spongiform encephalopathy, that we work on hand in hand with rabies, because both are basically diseases that affect the nervous system. And then the foot and mouth program. The foot and mouth disease is the other program we have. Regarding surveillance for BSE, we are free. We have been recognized as a country of insignificant concern since May 2018, and we have a surveillance program at all different levels. We monitor the processing plants for feed, the feed plants, particularly those that produce feed for ruminants. We have sanitary inspection permanently at the plants that manufacture those products, as well as epidemiological surveillance carried out on the farms themselves, the cattle farms, where we take samples of tissue of fallen animals that are suspicious or with symptoms, and we have surveillance also at the slaughterhouses throughout the country. In the industrial slaughterhouses and production plants, we have permanent surveillance, and something similar happens with the vesicular program, basically focused on foot and mouth disease, or the revalidation of our status every year. We already have a characterization of the different municipalities or areas that are most focused on cattle raising, and we have monitoring basically focusing on the months of July and August, and even in September through November, these are the months where the largest number of suspicious cases of vesicular problems in these animals. And that has been one of the factors that has favored the increase in cases. So our staff then is already on the lookout for those animals with the characteristic vesicular injuries to have a timely diagnosis. And in this case, this is the only disease where we send samples to the reference laboratory for vesicular disease diagnostic laboratory in Panama. For the other diseases I mentioned and the ones I will continue to mention now, our laboratory is prepared, has the necessary capacities, and not only in infrastructure, but in the skills of our own staff to respond to a rapid and timely response to a diagnostic. With swine, we have something similar as with poultry. We have characterized our areas of risk for us regarding African swine fever and classical swine fever. We were declared free of classical swine fever in May 2012. We do have a surveillance system very similar to that for poultry, very active. And we examine any suspicion of either of the diseases. Added to this, within this program, we have surveillance for all the red diseases, circovivid, salmonella, erysipelas in swine, and just to mention a few. And a great priority here are the border crossings for us. The airports and maritime ports, because of the possible introduction of African swine fever or reintroduction of classical swine fever. We give great importance to the hazard analysis that also worked on for the region. And that led to determine that all the border crossings, airports and seaports, not only for Nicaragua, but for the entire region, are the potential points of greatest risk for the introduction of classical swine fever or the introduction of African swine fever into the region, and particularly into our country. There is continuous surveillance. As part of our active program, we monitor the tissue. We take tissue samples, not only serology, but tissue samples also in the municipal slaughterhouses at the municipal level and for industrial processing. So for swine, not only is it serology, but also tissue samples we take and passive surveillance when there's suspicion of a disease. There's another very important aspect, both for our directorate and for our senior authorities, is to work on this day by day. Technical capacity building of our veterinary services and diagnostic capacities. Every year, at least, we do one national preparedness drill for our veterinary services, and we include all the other institutions in the national system. What is this national system for producers? These are all the government institutions linked to addressing the agri-food sector. So all those institutions that IPSA is a member of, we invite them because for us it is very important to train the technical staff of these institutions in the event of a possible emergency we may face. We have included the National Police, the Ministry of Health due to zoonosis, universities, international organizations, producers, and the private veterinary doctors themselves. This year, just for example, we had the first experience of a simulation or a drill with avian influenza. We did this simultaneously with the Ministry of Health. We simulated scenarios both with animals, basically poultry, as well as in scenarios where the Ministry of Health was confirming cases and the death of people, in fact, due to influenza. So it was a very interesting experience for us, very important to articulate with the health authorities and address these scenarios where we had the opportunity to interact simultaneously in two different scenarios. IFSA seeing the animal side and MINSA with public health. But with the same objective, the avian influenzas. These are simulations or drills that have allowed us to elaborate, to strengthen our technical teams and the infrastructure and the diagnostic capacity we have. After the national simulation or drill, we have held 4 more drills at the department level under the same system, but with a smaller number of people. And we were given the possibility to elaborate, to examine in greater depth the ability to respond that our veterinary services had in these simulations and drills. Using the same approach, but with a smaller number of participants. Well, as I was mentioning, with the support of our colleagues from Senacica, Mexico, we were able to strengthen all the diagnostic capacity, not only in poultry, but in shrimp, bovine, and others, and to implement molecular diagnostic in real time. This was truly a wonderful experience for us. As we said a moment ago, the Mexican authorities, and I take advantage of this opportunity to thank them for their support. Our teams are prepared. We have the ability now, in fact, to issue a diagnosis in 4 or 5 hours after the samples are received at the veterinary diagnostic laboratory. As you can see on the bottom part of your screen, we have obtained mobile units to address some emergencies that may arise. In the field, we have 2 mobile laboratories, the one in the middle down at the bottom, and 4 more units of rapid response for the event of any emergency that may arise. For IPSA Directorate and for our senior authorities, this has been a priority. That is why I mentioned at the beginning not only the technical capacity of our veterinary units, but also the infrastructure related to diagnosis of diseases simultaneously when implementing the prevention of all cross-boundary diseases. For us, it has been very important to implement awareness and sanitary education or awareness programs at all levels. Just as we have those drills I mentioned and all the training, in-person or virtual training courses we could offer through the different organizations in the region, we are also training producers, army, police, Ministry of Health, the technical staff of other institutions in the production system that I mentioned, and we develop all these materials. The triptychs and the pamphlets that we are distributing permanently at all different levels. We are also coordinating with universities for the message taken to the different sectors. We have included them in, and we have coordinated with the universities an opportunity to train the youngsters that are studying veterinary aspects, among others. We have information here, the different species, the different programs, and with poultry, we have developed some campaigns, sanitary campaigns. For example, in the slides here, you can see our staff in the vaccination process for the Newcastle, to prevent Newcastle disease. This we do basically in the backyard production units. We also have a program, a sanitary program for the prevention of some diseases in bovine, anthrax, rabies, for example, where the activities we carry out are to facilitate vaccines to the producers at no cost. With equines, we also have deparasiting activities, particularly in some places that we call mountain ports. By mountain ports, we mean those places that are more distant in our countries, and equines are basically used to transfer produce from the farm to wherever it is marketed, and upon return, they take food products for the family. So it is important for us to address the sector and these species because these are a tool. These are a tool for the families and the producers. To the right, you can also see some of our teams doing ecogram diagnosis as a system, and as a government, we have developed a series of strategies to foster production of different species. So we have developed, aside from the sanitary side, we have a link, which is the reproductive part. So these are some of the materials we have developed. These pamphlets, these triptychs, and we try to use as simple language as possible so that our growers and producers better understand the basics of these diseases. And even more important, for them to immediately notify the closest IPSA delegation of any suspicion they may have of any disease. As I mentioned before, we have the different materials and different species, and the same we do with poultry, the Newcastle avian influenza, and in December last year, upon confirmation of avian influenza in some Central American countries, the central government worked on a national plan of communication for the prevention of avian influenza. We developed an endless number of materials and audio visuals, including spots and pamphlets and posters, plus obviously the training or the technical presentations we were giving our producers. This year, we did something similar due to the threat of cases of the borer worm here. We have the Pochilomia Pneumorifax. So we have developed the same communication plan we worked on with avian influenza, and we have considered this for this borer. So these are the experiences that we have had in our country, and we continue to strengthen. We are aware that epidemiological surveillance is truly a task for everyone in order to strengthen the capacity of our staff and strengthen the capacity of the technical staff of other institutions and of our strategic partners. That is what has led us to have the strength we have and that we need to maintain that good status, working hand in hand with producers in different productive sectors. This is all I had to share, so thank you very much for the opportunity. Thank you very much, Dr. Wilmer. Very interesting to see Nicaragua's experience, the experience you have had with the support of other countries like Mexico and the laboratories in Panama, as you said. Surveillance is a matter of interest to us all. It cannot be focused on one single agency. There is so much to do, and that is why we have to bring in strategic partners, both internally within the country as well as abroad. Thank you very much for your presentation. And with this, let us continue now with our webinar, with the last presentation of the day. Dr. Roberto Navarro will be our speaker. Allow me to give you a bit of his biography before I offer the floor. Dr. Navarro is a veterinary doctor, graduate from UAM University in 1985 with a diploma in veterinary diplomacy from UNAM and a master's in the United Nations Millennium Development Goals. He entered the U.S. Mexico Commission on Foot and Mouth Disease and Other Exotic Animals in 1990 is currently its director. Dr. Navarro has broad experience in epidemiological surveillance of exotic and emerging diseases. His work has allowed him to identify the Venezuelan equine encephalitis virus on the coast of Chiapas and the West Nile virus in Tabasco, among others. He is also coordinating operations of emergency for the control and eradication of the borer worm cattle, avian influenza, classical swine fever, among others. He has also developed participation mechanisms for veterinarians in climate phenomena, emergencies, in flooding, in hurricanes, for example, in Mexico and Latin American countries. He coordinates the eco-epidemiological surveillance of avian influenza and vesicular stomatitis in wildlife cycles in Mexico. He has worked with aquaculture. He has trained teams that respond to animal health emergencies, aquaculture, health, and natural disasters in Mexico and Latin America. He has been a consultant for different international organizations, FAO, ICA, OITS, and USDA in the matter of training professionals to face emergencies. He is a professor of applied epidemiology in Latin America and the World Veterinary Education in Production Animal Health, Luxembourg University, Hawaii. With this broad experience of Dr. Navarro, I offer him the floor now. Dr. Navarro, go ahead. Thank you, Dr. Erica. Can you hear me clearly? Can you see the presentation clearly? Yes, we can hear you very well. Well, thank you. First, I would like to thank IICA through Dr. Erika Calderon and Dr. Campuzano for having considered the participation of Mexico in such an important forum and this webinar to inform about what we are doing regarding animal disease surveillance. In my case, I will refer specifically to surveillance of cross-boundary diseases, which are the diseases that can cause greatest damage to the economies of the countries and their production and public health also. We already heard a very thorough presentation of what the surveillance systems are all about, what they are good for, the types of surveillance that exist. And I would like to specifically refer to Mexico, where we have an organization that fortunately I am the director of currently, and that is the Mexico-U.S. Commission for the Prevention of African Swine Fever, of foot and mouth diseases, and other exotic diseases, and has a component of an international commission through the cooperation agreements we have with the United States to eradicate foot and mouth disease in Mexico in 1954. Well, the commission was responsible for eradicating this disease, and that we have been free of to date, obviously with the support of the very strengthened surveillance systems. Basically, for vesicular diseases, and the commission, as we know currently, for cross-boundary diseases was formed in 1988 with the creation of regional coordination units and a national commission, and with the creation of regional groups of animal health emergency committees or commissions. Let's hope we move to the next slide. Okay. Going into passive surveillance, which is also clinical and active. WOA does not divide it in passive and active. It just says that surveillance is designs the systematic operations and continuous recollection, comparison, analysis of data in a timely manner to make the best measures. And specific surveillance is designated to a given disease or infection. We talked about the technical foundation or basics of each one of them, so I will skip over that part. But in Mexico, as in most countries, we have divided this in active and passive surveillance. Passive surveillance depends on the notification of the sanitary event. When someone suspects there is a problem, for example, a vesicular problem, they will not define whether it is stomatitis or anything. They just report it, and the decision we make or the definition we make at the laboratory, and then the active part, which is based on sampling. Obviously, both supplement each other, and this would be the diagram of the two types of surveillance. So let us remember that the presentation of cases in the population, there will be a visible side and a hidden side. We always talk about under notification. People do not notify because they do not know, because they do not have the diagnosis. So what is the function, our function in Mexico? Well, to encourage notification of these diseases, obviously, through all the information generated through different means, with the bulletins and the presentations and talks, so that people can notify this. So each case that is notified is, of course, a case that is recorded in our surveillance system. Obviously, we know there are cases that are not notified and therefore not recorded, but we know they do exist. When we are looking for an early diagnosis to control a disease like avian influenza or African swine fever, well, we need to have a significant number of notifications to find the real cases in an early manner. Because an exotic disease or emerging disease, well, we will realize sooner or later, but we would rather have it be earlier instead of later. And if I have foot and mouth disease, I will realize. But when did it start? Well, perhaps it started months ago and I had not realized this. So when we find a clinical case of avian influenza, African swine fever, for example, as a registered case, I immediately go aside from passive surveillance. I move to active surveillance. I go to the subclinical level. The subclinical level will allow us, in fact, to see the cases before they are evident in production or in mortality. And I can give you a couple of examples. H1N1 last year, there were 5 cases, but there was a timely reaction everywhere, and we were able to do sampling of the mortality and detect, in fact, the production units that were infected before the producer even found out. And we could have controlled it and avoid the disease from spreading.
So, what do we do at CPA? We establish an epidemiologic surveillance program that allows us to detect in a timely manner the presence of an exotic or emergent disease in animals in the national territory. So, we have a virus of the Nile or other examples and we let the health secretary know about it, and for this we promote and take care of the report of diseases, and we also supplement them with the timely diagnosis at the national level. And I'm going to talk more about this later on. And also, if we're looking for exotic diseases, if we detect them, we need to have our plans and programs to respond to an emergency. So we have an animal health response system, and everybody has to be aware of what to do when a disease is found in their territory. So for notification, we have a system called a syndromic surveillance, and this was mentioned before. That is to say, we promote noticing or notifying diseases that cannot be differentiated in the field and that have to be differentiated in the lab. For example, vesicular diseases, after the foot and mouth disease, and like in livestock. But we also have others, like in the swine. And this is another way, this is something else that we detected last year through this type of surveillance. We also have the detection of rabies and others, that the crazy cow disease that can be found through this surveillance, the equine encephalitis, like in Venezuelan of the East, and the virus of West Nile, that are zoonoses that are very, very important, that require early detection for their control. We can also have cavitary We have not stopped surveilling that because we have the worm in the livestock, and we know of the risk that exists because of the presence of the parasite in the Caribbean and South America, and currently of the outbreaks in Panama and Costa Rica. And that's why we are paying attention, because they may advance all the way to Mexico. And then we try to increase the lifespan of animals, prevent their mortality, whether they're domestic or wild animals, and other diseases as well. How do we set up a surveillance system? I was telling you that in Mexico, we have a specific commission that is specifically dedicated to this task. And compared to other countries where the service is provided through the campaigns for different diseases, in which you can find maybe a vesicular problem and not detect something in time because there's no personnel specifically dedicated to that activity. So here we have an example of what we do in terms of epidemiological surveillance in wild birds faced with the avian flu threat that arrived into Canada and the US. And this was established in 2014. So we have 9 years of experience as of today in these terms of surveillance and monitoring. So there's a specialized team of biologists with a master's and doctorate degree and PhD degree that know very well the types of birds, where they go to, where they arrive, how to capture them, to do the tests in living birds and also hunted birds during the fall and the winter. But in the rest of the time, it is also used to monitor these wild terrestrial birds that have interaction with production sites and with the water dwellers that is allowing us to identify the birds that serve as bridges, the birds that can become infected in the wetlands and because of biosafety problems might take the avian flu elsewhere. So this has generated a number of publications that we have made available to many people. We also have the notifications for mortality rates or events in domestic birds, something that is very important for our countries. In Mexico, we have around 50 million birds in family bird breeding, and this is particularly important in terms of the production of egg and also the production of chicken meat. And so when we detect a case of avian flu, they are quarantined and we apply the right measures, and the surveillance is immediately implemented for buffer areas and the specific areas and neighboring areas. So we look at the mortality without allowing staff members to go into the farms. You can see how the sample is taken with tracheal samples that are taken to our labs for diagnosis. This system that I just talked about in fostering notification is done through epidemiological contact points. These are veterinary pharmacies and producing organizations, livestock and agricultural organizations, and so on. In 2018, we were talking about 117 notifications a year. Now, with this system, we are having over 1,000 notifications, and even during the pandemic, as you can see, since we had an increase here because we never stopped working in the field. And as of 2023 to September, we have 1,105 notifications. These include also the death or mortality of marine birds, because we are in touch with other institutes like Protected Species Institute and others, so that we can all have a very good report. And of course, this is said very easily, but each of these researchers required personal protection equipment, the transportation and tools and so on and so forth. So these are all very expensive. And whenever we establish a surveillance system, we need to also think about our capacity to establish it. Something very similar is something that we did with the African swine fever. The classic swine fever was already eradicated in Mexico, but we realized that there are many, many diseases that endemic diseases that clinically are hard to distinguish from the ASF. And this catches our attention because not all countries have a large number of notifications when we're talking about diseases that we see on a day-to-day basis in the farms and that are not being considered as suspicious. And this may have an important impact on the diagnosis. So here you can see what we do when we do some research for these diseases, blood tests, necropsies, where we get notices as well. So we had the same situation. In 2018, we had around 88 notifications on average. And prior to this year, they were all very similar. And right now, when we have our surveillance system in contact points and in slaughterhouses and in other places, up to August, we have 647 reports of suspicion of ASF in the Mexican territory. So, just like before, this also requires lots of work from our laboratories and capacity. So if it's not AFS, what is it? What are the diseases we are finding? And so using PCR tests, we see that the most common pathogen is Glasarella, but we also have Seneca virus, Pasteurella, Mycoplasma, Salmonella, and other diseases, including erysipelas and others. And we're also isolating other bacteria-based pathogens. So we have a high security laboratory, and if it's negative to ASF and classic swine fever, they are sent to the lab and to the National Lab for Animal Health, which is another national organization of national reference. And so here are some of the cases that we have observed during these notifications. And I can ask you, which of these cases do you think might be ASF? And here we realize that clinically we cannot do this. See, you can see here what are the diagnoses and the different places. And we have one for African swine fever in the laboratory of Plum Island. So it is not possible to do differential diagnosis in the field. In terms of necropsies, when we look at the tonsils of many of these cases, we can see that many of them could have been ASF. And that's why it is so important to carry out this kind of work if we're looking for an early diagnosis. So to do this, what is our work strength and our operational capacity? As I was saying, we have 8 regional coordinations. You can see them on the right. In each one of them, we have a regional coordinator. I worked for 22 years in region number 6, which is Chiapas in the border with Guatemala, doing this type of work of surveillance that are now being implemented at the national level. You can see that the staff members in the regional coordinations have 88 expert veterinary physicians in taking care of the notifications and the application of the measures against the epidemics when we are able to find a situation like this. And 96% of notifications are taken care of in less than 24 hours after the receiving the notification. So this will also definitely depend on the resources for gasoline and availability of the personnel at the moment. So these are the contact points. We have a veterinary colleague here in veterinary pharmacies promoting notification in this contact point. We have over 20,000 in the country with the geographic location, name of the contact person, WhatsApp, telephone number, where they can collect information, epidemiological information of what we are generating. So for example, if we were to detect a avian flu case in this area, we will let all the contact points know so that they're aware and they can inform producers so they can apply some biosafety measures or other measures to control it. On the right-hand side, we see a plastic poster, a long-lasting poster where it talks about the diseases that are required to be notified immediately in a mandatory way. So we have high mortality in all of those species, some blisters in their mouth, foot or nipples, fever, lack of coordination, and aggressivity, lack of coordination, loss of weight, intense itching, and fever or lack of appetite in pigs. So there you can see what they need to tell us about if they see in this species any of these symptoms. And so here we put in this white space, we put the telephone number of the zone coordinator. It's a phone number that is given on behalf of the commission so that they can answer 24/7 any notification. We also have an emergency telephone number at the national level, and we also have an electronic platform called Avise. Let us know, where they can enter their data, basic data, and we can get also pictures and the telephones so that we can get in touch with this person. We also have this other poster that we are developing. If you want to avoid the avian flu, you need to scare this bird away. This is a bird that is very common in our countries nowadays, but they also visit this when there's poor biosecurity. This animal can get infected, and this is the common grackle, and it's important for this to be avoided because they can get infected and they can infect the other birds. So it's important to avoid the entry of this bird in their places. So we have 21,395 contact points, and each of these 21,395 contact points need to be contacted 2 or 3 times a year to keep a good surveillance, because maybe the contact point may change, they may close, they may change owner or manager or veterinarian. So this is the app that we use for notifications. It's called Avise. Let us know. It's available for all cell phones, iOS and Android. Here we see where they can enter their basic data. They select the species. So for example, here they select the swine. They say that it's high mortality or sudden death, that they look, they have marks in their skin that are either red or purple. And they also can send us images, and then we can send us that information and we can visit that place in less than 24 hours. As I mentioned before, we also have some training courses that are very, very important, such as the AutoSim courses that many of you might have heard about in other countries. And these are available in a platform where you ask for the course, and then a certificate is provided once you conclude the course, and the certificate is provided automatically. So there's got to be a request on behalf of the school or the producers or veterinary organization that want to take it.
Capacitaciones presenciales. Tenemos
Still
también
giving on-site trainings. And we also have something for the screw worm and in livestock. And so this is something that is being seen not only in Mexico, but also by other veterinary centers in Central America. We have a place to store all the information that we generate. This is a platform, a virtual platform, or a computer platform called Cinexe. So this is for the epidemiological surveillance system in Mexico. Is part of Senacica. So we gather the information from this source and other sources and other laboratories. And to communicate to people what we do, we publish this bulletin called Avise, Let Us Know, where we talk about what's the most important, hardest topics at the national and international level. And we give some cases that we're taking care of in what places, so people can take the necessary precautions and be better informed. And whenever we have an emergency where the national emergency alert is launched, we have this avance of, for example, avian flu, where we talk about what's going on internationally and nationally, and giving biosecurity or biosafety alerts from different veterinarians of authorized follow-ups and things, so that these are indicators that may help our animal health and health emergency places, both for humans and animals to react. So we also have the emergency plans that are tested in different simulations. We have a number of examples here. The most recent one is the one in the bottom left, our emergency plan to take care of the African swine fever in Mexico. A simulation was done at a national level, and the 8 regions, emergency regions in Mexico were involved, and we give them different scenarios, including bioterrorism and family production farms and commercial production farms, federal inspection plants where the diseases are detected, and about 800 people participated with observers from international organizations as well as national organizations and universities. And there are a number of publications with regards to this topic that you can find in our web pages. We also have procedure manuals that are used to train our emergency state animal health units. We have to do with suspicious cases in case of emergencies, for humanitarian sacrifice, for health disposition in animals, for the disinfection that need to be applied during the emergencies. So our personnel has to have the necessary elements for the personal protection so that they don't become vehicles for transmission of the diseases. We also train them with regards to biosafety. They have to know about pathology for the sample taking. We also have all these areas quite robust at this point. And here is what we do when we receive a notification. We have our field people, they take the first measurements and epidemiological information. We have specific formats to do that. If it's something that requires personal protection equipment, they have to take it with them, and they clinically observe the animals, then take the samples, do the necropsies that are sent to our labs for diagnosis and high safety diagnosis labs. And so they all have to have this equipment permanently, and as they wear off, they can ask for a new one so that there's no situation where because of lack of material or equipment, they cannot do their job, or things to be done without following the necessary measures and become a threat to the person's health or other people's health. Very recently, our Secretary of Agriculture inaugurated this center for the diagnosis of exotic and emerging diseases in Mexico, Palo Alto, where we have a molecular immunology laboratory, a laboratory for biosecurity at the level 3 with an area of level 4 for animal, and 6 areas for isolation to do biological tests in animals. And this has been reinforced by the laboratories of molecular biology distributed in different parts of the country, and 2 regional laboratories, one in Guanajuato and the other one in the state of Jalisco, where the largest livestock and bovine, porcine, and aviar activity takes place. And we have this other 2 centers, national reference centers, one for diagnosis of endemic diseases, and the other one that is specifically dedicated to the certification for safety and parasitology, and that is also doing the follow-up for the virus that we identify. So in response to an emergency, when we never detect something, we have a timely attention to the reports. We also have the inactivation of points for exotic diseases we are always updating and executing our emergency plans. We have programs for training and communication that are permanent. We also have the activation of the National Emergency Disposition, the coordination of animal health, as published in the Federation's official bulletin with the support of the Ministry of Agriculture. We also have the capacity to diagnose and identify exotic agents in a timely manner. And we also coordinate with our laboratories from the US and or partner laboratories from the US and Canada. So would also serve as reference. So these are permanent actions. And I was also telling you about the national device for emergency in animal health. This is activated whenever we detect an exotic disease. And the Ministry of Agriculture, Secretary of Agriculture, and our field, federal, state, and personnel, and from aiding organizations turn this into their priority. We have all the different coordination mechanisms of SENA-SICA together with other institutions. I'm not going to go into that at this time. And everything that has to be developed whenever a national emergency alert is activated. And this, we have the National Security Council, and then we have all the other 32 points and the connection to the president and GISA, DINESA, and all the different dependencies and departments for the control of an epidemic outbreak. These are the state groups for animal health emergencies in Yucatan. Article 95 in our act law says that in terms of sanitary campaigns, the auxiliary organisms or organizations are must comply with the following: participate actively in the monitoring and epidemiological surveillance for animal health. Another example of our emergency groups, this is from Chiapas, that was working in the simulation for African swine fever of 2019. So I think that the surveillance systems have that function of protecting the livestock patrimony of countries, be it a domestic or wild, and also public health when we're talking about zoonosis. Thank you very much. So thank you very much, Dr. Navarro. Thank you for your experiences in Mexico. I think that today we have had some very good examples of how all the different surveillance systems are being run and how this has to be done internally and together within countries by the emergency departments or commissions. So thank you very much. So now we're going to start with the Q&A. We're going to take a few. Maybe we will have the chance to answer them all today, but I will try to do some. So Rocio Camposano will help me with that. So, doctora.
Thank you. Good morning. Thank you for staying here so long. A question is for Dr. Mergin. What type of surveillance do you see for countries that recently are strengthening their systems, for example, for African swine fever and other cross-boundary diseases? That is, how to start the most important or the most appropriate surveillance system for countries that are trying to bring their epidemiological units together. Thank you. Dr. Mary Jane? I wonder if she is out. No, I do not see her connected. Oh, heavens. Yes, I was looking for her among the list and she is not connected. Well, there is a similar question for Dr. Navarro. What would be the first steps for a veterinary service to begin to implement a cross-boundary disease surveillance system similar to CPA? I believe Dr. Navarro could answer that, and Dr. Wilmer could perhaps elaborate too. Dr. Navarro, go ahead. Yes, thank you, Doctor. Well, I believe the first thing we should have is the political willingness to do so, because this, of course, calls for resources and support. If there is the political willingness, there must be funds or resources behind this to set up this plan. That will need the resources, obviously. And the second thing is, what do I seek through a cross-boundary surveillance system? What size is my population or the population I will have? What staff do I have available to do this work? How will I train them? How will I prepare them? And then if I begin to have suspicion, well, will these people have the materials and the vehicles to respond? And then think of taking things to the laboratories. What laboratories should be able to carry out the diagnosis in order to submit the samples there? For example, if I have a suspicion of avian influenza because of the death of poultry, well, the laboratory must have the testing system, the serological tests, and all the isolates of virus and identification of viruses. There's a whole background that needs to be available in the laboratories, as well as trained staff. And thirdly, if I find this is a cross-boundary disease I had not detected, well, how will I respond to it? With what staff? With what staff will I control it or eradicate it to avoid having another disease in the territory and cause alarm among the population? So we have to respond there. And for that, we have the example of the Dominican Republic with the African swine fever, and we have other countries that have detected a disease perhaps too late, and they do not know exactly how to respond. And this obviously jeopardizes neighboring countries or non-neighboring countries, but with which they will have a trade. This is not easy, and this needs to begin by the political willingness and the resources. Dr. Wilmer, would you like to add anything? Yes, of course, thank you. No doubt, I share what Dr. Navarro has said. The implementation of a sanitary program will require not only the resources, but also the political willingness. And let me show you how we made significant progress. For us, it is essential to certify our veterinary services as done by WOA in back, I believe, in 2011. And they gave us a series of recommendations. In fact, we developed, or we had a gap analysis. We underwent a gap analysis, and the part of infrastructure was important, the diagnostic capability and the fact of giving stability to the technical staff. That was one of the aspects that the PDS focused on the most. And our authorities and the President of the Republic, through the different institutions, had to create a list to give labor stability. When the first PDS was undertaken, the proportion was that 80% of our staff was under temporary contract, and 20% were on the government payroll. So one of the recommendations that was worked on was to ensure the labor stability of the staff, strengthen their technical capabilities and all the part of the infrastructure, laboratory equipment, the media, and all those things that Dr. Navarro mentioned are key. And added to this, the organizational structure itself of the institution and of the directorate specifically helped us very much. Thank you, Dr. Wilber. Go ahead, Erica. Yes. I was going to read the comment left here by Hugo Araya. He says, I believe that the big initial challenge is to define the sanitary objectives, and based on that, establish the type of surveillance and what techniques, for example, should be implemented, and then produce the development plan. That is Dr. Hugo Araya's comment. Well, let us move to the next question. Dr. Wilmer, this is for you. Could you tell us how the veterinary service in your country works with other countries in the case of suspicious cross-boundary diseases? You can, and I'm sure that Dr. Roberto can add to that later. Yes, in fact, I mentioned this at the beginning. Our organizational structure is at the department level. Provincial, that is the geopolitical division we have of our territory, a state, a province. And aside from the delegate, the executive director, there is technical staff of the animal health division, and we have had experiences with neighboring countries. The most practical example I can share with you now is that Costa Rica confirmed a case of the screwworm very close to the southern border, on the southern border in Nicaragua, and we have articulated efforts to focus our surveillance on that border area, seeking for animals suspicious of having the screwworm. And we have had experiences in previous years, a case of Newcastle in 2015. There was a case reported very close to the border, and we developed this surveillance plan, and we detected poultry positive to Newcastle. And their sanitary actions in different countries, basically follow the national regulations, but basically all in line with what WOA has suggested. Thank you, Doctor. Dr. Navarro, would you like to add anything? Yes, I believe that never more than today do we have as much information of what is happening, not only in our neighboring countries, but also at an international level regarding the presence of these cross-boundary diseases. And that has helped producers and veterinary doctors know what is exactly happening. International organizations like Senasica, for example, have worked very closely with this coordination. Needless to mention, OIRSA, in charge of agricultural health in Central America, including Mexico and the Dominican Republic, but we also have the participation of the FAO and the U.S. Department of Agriculture that is allowing us to know about this, because it is not convenient for anybody that some veterinary services not be informed, because this weakness in a given country, we have to instead turn it into a strength, because if someone is weaker, there could be a problem, and this could spread to other territories very easily. We have now the screwworm, as Dr. Wilmer mentioned. I have not seen you for quite few years. Great to see you, but the screwworm is a very serious problem. We need much more information of what is happening, information on African swine fever in the Dominican Republic. This has cooled off a bit. After the emergency, the situation in Haiti, we know it is out of control. And with that, we could give other examples of other diseases that only through communication and transparency can we get help. The impact on trade should be ever less on occasion of these diseases. I must always act remembering that if I close down, what impact will this have on the producers if that was not a necessary close down? So we need to ensure trade, healthy trade in as much as possible in our countries. Thank you. Dr. Campuzano, yes. Well, yes, I would like to ask our two panelists, since Dr. Mary Jane unfortunately has disconnected. I wonder if they could give us perhaps recommendations basically to end the webinar, and then the doctor will make some announcements. Dr. Wilmer, and we end with Dr. Navarro. And Dr. Erika has some announcements. And by the way, congratulations by CBP. Excellent seminar. Thank you for sharing all that information. So go ahead, Dr. Wilmer, and then Dr. Navarro. Thank you, Dr. Rocio. Dr. Navarro, so good to see you again, and almost in person. You have been of great help to us personally, and you have helped our country, our institution. Thank you for your support. We have made a significant quantum leap. I believe this type of event, in fact, helps very much with the implementation and strengthening of surveillance systems in each country. Dr. Navarro mentioned this a moment ago, the support and coordination with international organizations, and what we are doing together is very important for the prevention and even for the control of diseases that unfortunately have come to some of our countries. And added to that, well, the capacity building of our own personnel helps one way or another to be better prepared in the possibly sanitary event. Today, we have many opportunities there. There's so much information, virtual information of international organizations. This is readily available, and sister nations like Mexico, we had the opportunity to participate in an online course they had regarding screwworm. And that was very important for us because 90% of our surveillance staff are young people, very young people, and that really did not know much about screwworm except for the bit of information we have documented and facilitated. So I congratulate you for this type of initiative that ICA, WOA, FAO, and all the other organizations that are working in animal health carry out to preserve the sanitary status of each of our countries. Thank you. Thank you, Dr. Juarez. Go ahead, Dr. Navarro. Well, a few years ago, I do not remember how many, but I know several, WOA said that veterinary services are a public asset, an invaluable public asset, and it is ever more important to see what we are doing in the area of One Health, other areas. And as doctors are being informed of what we are doing, so we understand each other better, we can coordinate better. The same with biologists and the environmental experts that work in the organizations, natural resources, all these people, we have this interaction. and together to build One Health, which will have to trickle down. And this has to do with the surveillance systems, with the information, so that they understand when we say something, they should take it seriously. Because behind all of that, there is support, a lot of hard work. And vice versa also. We must be informed of what they are coming across. Zoonosis that sometimes they do not know how to handle them. We could possibly help through our veterinary services, and that is all in benefit of the population. I see a significant lag in many populations regarding animal health because people do not have access to reliable veterinary services or medication or laboratories. So these are niches where we lose people, and that represents a big risk for their health and their economy, because those animals could reach human consumption chains for some reason or another and cause human health issues. So we have a lot more to give, but I believe we are on the right track. Thank you very much. Thank you very much, doctors. Go ahead, Dr. Calderon. Well, thank you both very much. These were excellent presentations, a very interesting webinar. And I would like to thank Dr. Mary Jane, whom unfortunately had to leave us. But anyway, before we wrap up our webinar for today, I have some announcements. I would like to invite you to the next webinar to be held, the last one this year, on December the 5th. This is initial research intervention in this case of suspicion of an outbreak, and I would like to invite you to join the link that my colleagues have shared through the chat. You will see the platform there where we have all these webinars housed. These webinars are like gold. You can share those in your countries. So try to access them. We have a whole 2 years of webinars for the prevention and response to cross-boundary diseases. So these are all available to you in all languages, in fact, as well as the presentations we have been receiving over the years. Another announcement. All agencies are developing a survey, a poll. We want to measure the impact of these webinars on all of you. This is a poll first at the official sector level, but then we want to see if we can add it here to our webinar so that all sectors, private sector, academia, guilds, associations that join us at these webinars so that they have the opportunity to respond to that poll. We want to measure the impact to continue with these initiatives, these training initiatives to the future. So those were the announcements. And with this, we would like to end our webinar for today. I would like to thank Dr. Wilmer, Dr. Roberto Navarro, who is always with us. He has been with us on several occasions now. So I would like to thank you all, Katia, Rocio, and all colleagues from the different agencies and our colleagues from MIICA that have helped organize these seminars. See you soon. Thank you all very much. The knowledge is there. You can consult all the webinars on the website I have added to the chat. This is the interagency group, so you can find all the webinars there. Share those. And invite all your colleagues to join us every month. Goodbye, goodbye. Thank you very much. Okay, big hug to you all. Thank you. Goodbye, goodbye. Greetings. Bye.